Yeah, so just for context, the guy for the introduction, that's Patrick Horn. He's our Chief Operating Officer from MindStride, and we're an organization looking to really be proactive with people's health, get them access to primary care, get them access to mental health services, and then my true passion is along the lines of preventative health. How do we get folks in a good enough shape that they're not so reliant on being in hospital and so forth? So really been excited to work with this company. I've been with them almost a year now as chief medical officer. And so we do these regular information sessions just so that folks can, really get a sense of issues that a lot of community members might have. So last month we had one on perimenopausal health, which has been great. So we also have a great clinician, Serena, that is able to see patients that are struggling with those symptoms. So yeah, this is just a real big initiative from our perspective to inform the public and really give you a sense of how you could take control of your own health. All right, so Dr. K here, ICU doc during the day, but real passionate about how we could get you guys healthy. And so you guys were able to pose several questions, and so we're just going to get right into it. And if you have more questions, for sure, just throw them in the chat, and we'll do our best to address them immediately or as soon as we can. All right, so one of the first questions that came up: what are the 3 proven methods for sustainable weight loss? And what I try to avoid when it comes to weight loss is to have a cookie cutter formula for it, because a lot of people, it's depending on where you are in your journey. So one of the methodologies we've established is, we call it the press method. So P is for, what is your why? What's your purpose? Why do you want to get healthy? And the nice thing about that is it's a nice anchor for when you don't feel like going to the gym, or you don't feel like eating as well as you need to be, or avoiding some of the foods that we should be avoiding. Is for restoration and stress management. E is for eating/nutrition. S is for strength and exercise. And the last S is for social connection. So when we see a question like, what are the proven ways for sustainable weight loss? It depends on what you're struggling with. So, for example, if you're somebody that is going to the gym regularly but aren't sleeping well, that's going to be the lever that we need to focus on. If you're somebody that is going to the gym regularly but is having pizza post-workout, we know what area we need to be focusing on. But I will say what I find is the most common ways to sustain weight or lose weight. Number 1 is nutrition. That's the 80-20 of your health, to be honest with you. Even if you exercise like a fiend, it's hard to out-exercise a bad diet. And the best lever from my perspective, and the evidence is catching up to this, but if we focus on your protein intake, you are going to be miles ahead. So the great things about focusing on protein is that you're going to put on more lean muscle. And when you have more lean muscle, you burn more calories in general. You are going to feel fuller. You are going to have less cravings. Your blood sugar levels are going to be more stable compared to if you're not having enough protein. And so if you focus on protein first, I'd say protein first, like when you have that plate of, when you whether you're going out to dinner or whether you're having that meal at home, if you focus on making sure you get to your protein goals, then the fiber, which would be, I would say, your greens and your vegetables, your fruits, then think of carbs. That sequence will really move the needle for almost everyone. Whether you might, depending on where you're at in your health journey, you might not have the same weight, but put on more lean muscle. You might start shedding the pounds. I think one of the ways you'll see it is you'll see like your waistline and so forth get more in line with somebody that's metabolically healthier. So the magic sauce, honestly, is focusing on nutrition, protein intake, the minimizing ultra-processed foods. And then the second, for me, in terms of major way of making sure you sustain your weight or lose weight is weight training. Everyone thinks maybe you got to put more eggs in the cardio basket. But when you are doing weight training, you can add cardio components to it. So if you're doing, as an example that I can think of right now, is like a kettlebell swing. If you're doing kettlebell swings, and that exercise is gonna help you put on lean muscle, but it's also gonna help you burn calories and get your heart rate up. So there's a lot of ways of killing two birds with one stone. Increasing your step count for sure, making sure you're getting those steps up, and minimizing ultra processed foods, I think, is another one that really can help move the needle. But in terms of, to answer the question directly, 3 proven ways, like there's a lot of approaches, but nutrition is going to be the highest lever, and exercise, and I shouldn't ignore sleep too, which we'll talk about in a second. So great question. Thanks for putting that in there. The next question I see is, cortisol is known to be the great villain these days. Do you have any extra or different tips on how to prevent cortisol to increase in your body? Very good question. I think intuitively, a lot of us know when we're stressed and that cortisol levels are going up. And the more and more I think about it, it's intuitive. Like a lot of us will feel it in our body. Sometimes it will reflect on how much sleep we're having. Like one of the telltale signs I find that people are really stressed is that they have that 3 a.m., 4 a.m. wake up and they're not able to fall back asleep. That's a big one I see amongst folks. So how do you reduce your stress? So number one is making sure your sleep is on point. Really making sure that is non-negotiable in so many ways. And so how do you do that? It starts first thing in the morning, getting outside, getting that sunlight on your eyes. What that does is it resets your circadian rhythm. So it tells your brain that about 12 hours later, we should start reducing our stress hormones, our cortisol, and increasing our sleep hormones. Second thing I would emphasize is making sure we get enough steps throughout the day. There's a nice study out there for military folk that were having trouble sleeping, and all they did was increase their step count by 25%, and that increased their sleep pressure, so that ability to fall asleep. So this to me is one of those low-lying fruit where get moving throughout the day and you'll reap the benefits. It's like those European trips that you take. Third, to think about for enhancing your sleep, making sure you're not, and ultimately your stress levels, is reduce your alcohol intake, but especially don't take it too close to when you're going to bed. So some will say 2-3 hours before bed. I'd say the further away from bedtime, the better, because alcohol prevents you from having having that deeper levels of sleep. So you'll fall asleep, but you'll have a more restless sleep as a result of alcohol. The biggest one, I think, if you're going to choose one thing to do, is avoid using your phone close to bedtime. That blue light that gets emitted from your phones reduces your melatonin, which is your sleep hormone. So it's tougher to fall asleep, and it's also, you're going to have less quality sleep when you try to sleep. So I'm a big fan of avoiding the phones, but if you are going to use your phone, you could do that $15 investment on Amazon for blue blocking glasses that can minimize the amount of blue light that you'll receive. It's not perfect, but studies have shown that it helps to improve your sleep quality. So that's a big one for me. In my house, we start throwing blue blocking glasses usually right after supper to minimize that blue light and improve that sleep quality. And then there's some motherly ones, like keep the room cool, use nightshades or block out blinds, or put on an eye cover if you don't have that ability. So yeah, really focusing on when it comes to those steps to improve your sleep. Aside from sleep, reducing the cortisol, making sure you're getting daily movement, exercise. Exercise has been shown to be just as effective as antidepressants and anti-anxiety medications for folks. So that's the power of moving your body. So that to me is another way, a good way of reducing that cortisol. Third way is a gratitude practice. This is we put in our book, Prevention Over Prescription. This to me is something like, especially earlier in the day, I find, because it sets the tone, you're more primed to see some nice things, and to be as specific as possible, I think is a great approach for that. And lastly, I'm a big fan of breathing exercises. So you could do mindful meditation, but I'm a bigger fan of breathing exercises because you could do it while you're waiting for coffee. And a quick example of this is one that we call the physiologic sigh, where you take a deep breath in. At the top of the inspiration, you take a sniff, and then a slow expiration. You rock that a couple times during the day or while you're waiting for coffee or while you're stuck in traffic, and you're going to feel like that cortisol levels will dip. So those are the ways I suggest. But thank you so much for the questions. I think I answered this a little bit directly. What can you do to get more than 3 hours of sleep at night, especially if you have chronic insomnia? So I think there are two buckets, to be honest with you. There's a bucket of people that can't have trouble falling asleep. Excuse me. And there's a bucket of people that can't fall back asleep. So they get woken up in the middle of the night and they can't fall back asleep. So the people that have trouble initiating sleep. So it's a bit repetitive, but I'll just reinforce it. Not eating too close to bedtime, not drinking too close to bedtime, using the blue blocking glasses, avoiding using your phone. The other thing I would suggest is in terms of supplements, magnesium, glycinate, or L-threonate are also very good at reducing cortisol and getting you calmer before bed. So it can work on both angles, but mostly that sleep onset. You might read about melatonin. This is a medication that can very much so help with sleep onset, but the true indications, in my opinion, are for when you're transitioning, like when you're jet lagged or I can't think of the right word, when you're adjusting to a time zone. That's in my opinion, the true indication for melatonin. And I do have some personal concerns with taking it chronically, but yeah, that would be the approach that I would think of. So yeah, I'm a big fan of magnesium, less so of melatonin, at least not on a chronic basis. But that could also help with if you're having trouble falling asleep. And then in terms of people that are waking up in the middle of the night and can't fall back asleep. So a few angles that I've seen that have worked. Get up and like do something boring. Get up out of your bed, start reading or listening to a extremely boring podcast or a book, or start reading something that's very dry. Like most people will say like something, actually some people say fiction, but I don't actually think it matters. Read something that you think is relatively dry, but get out of bed. I think a lot of people just try and get focused on the clock and then feel like they just got to lie in bed. I think getting out of bed can be very powerful. Avoid looking at the clock. This is something that we all love to do, and I know I do it, but if you could avoid looking at the clock and knowing what time it is, because that's just going to produce more anxiety. Third is breathing techniques again, whether it's box breathing, whether it's physiologic sigh, doing some breathing / meditative content can help you fall back asleep. There was one more I was going to say, but it just totally escaped my brain. But ultimately, and then once again, the people that are waking up in the middle of the night, often that's a signal that there's a lot of stress happening in life. So just thinking about how you can mitigate that. But those are the key steps that I can think of, the common ones that if you're having trouble falling back asleep. So hopefully people find that helpful. And for the person that asked that question, hopefully sleep comes to you a little bit better. All right. Next question, best exercises for osteoarthritis in the knee. I know not all of us on this call are super young. So I would say in general, when it comes to exercise, remember, once again, it's not a cookie cutter thing. Not everyone needs to be running their 10K. Not everybody needs to be doing all these crazy CrossFit stuff. It's what works best for you. What's going to allow you to be more consistent. So I never run. I hate running. So, and I was just talking to Pat earlier. I'm on a bum knee today. So this to me was a bit timely. So biking, excellent for the joints. Swimming, the best out of the best for your joints, I would say. Elliptical for most of us is great. And once again, you got also what's the High Rocks one? The skiers, excellent. And just walking. Like if you're feeling like, depending on if the walking is over, can be a bit painful for your knee or not. But yeah, just being able to mobilize through walking can be very powerful, but not necessarily overdoing it. Certainly there'll be some resistance training activity that you could do to try and enhance that. So just thinking about that, I think that would be also a great step for a lot of people. But I hear you though, as you're getting older and these joints start to fail you, it can be quite challenging. So next question I got was about plant-based protein. What's the difference? Is one better than the other? This is a great question. Yeah. So I will just say this. All of you I would rather you take any form of protein, plant, animal-based. I don't really care as long as you get enough. And how much is enough, which is another question. Anywhere from 0.7 to 1 gram of your ideal body weight. So I'm 200 pounds-ish. I aim for 140 grams to 200 grams of protein daily. And it's hard to do this. But as I said before earlier in the talk, is that this allows you to achieve your health goals in one of the easiest ways possible. So keeping that muscle up, getting your percent body fat down, more stable blood sugar, increasing your lean muscle, all these things get better if you focus on protein. So the difference between animal protein and plant-based protein is mostly in the bioavailability. So what does that mean? So when I ingest animal-based protein, most of the building blocks, the amino acids, are absorbed relative to plant-based. So essentially, I'll have to have more plant-based protein to get the same bang for my buck as animal-based protein. Is it enough that I worry that you shouldn't be taking plant-based? Like I said, I don't actually care. Just take, as long as you're getting some, or you're getting close to where your goals are, you're going to start moving the needle. Because 93% of y'all aren't having enough protein. There's another point that I want to make about protein intake too that people forget about, is that it takes more energy to burn protein than it does than carbs or fat. So what does that mean? If I have a big steak, or like if you go to the Brazilian restaurants and you have that big steak dinner and eat all that meat, I'm sure some of you have experienced some meat sweats. You're just like uncomfortable, you're sweating, you're hot. That's your body working to digest the protein. So that means about 15% of the calories that you read about from that meal, from that protein source, goes to digesting the protein. Whereas 3 or 5% go when you're eating carbs or fats, go to the digestion part. So it's just another angle to think about on like how much more efficient you are at burning calories when you focus on protein. But good question about the plant-based. Best supplement for fitness recovery. One of my favorite questions. So a lot of us, depending on where you're at in your fitness journey, the next days can feel like crap and stiff and not feel like training afterwards. So what supplements can you take to help with that? So my number one supplement by far has got to be creatine. Creatine is magic sauce, folks. What's the advantages of creatine? You are going to increase your lean muscle, be stronger, and recover faster from exercise, all by taking creatine. You are going to be mentally sharper because it works on the brain, and have less depression and anxiety symptoms by taking creatine. There's a lot of worries, and the best part that I get excited about is that it's probably our best studied supplement, and it is one of the safest ones out there. So why we bring it on a guided nutrition, that's why I take it every day. My 3 out of our 5 members of the family take it on a daily basis. And so that would be my number one medication for recovery. I also like magnesium at night, for one, because it helps with stress and sleep, but also it helps for muscle relaxation, which I think a lot of us can use after a busy day of training, plus work, plus all the things. All right, so that's that question. So as a 56-year-old former night shift worker, I'm concerned I have too much damage, overweight, type 2 diabetes. What would be the main thing to focus on? So this one I've answered a bit already. So if you're really struggling right now with your weight and your health, nutrition is the most efficient thing. Focusing on protein intake would be the number one thing, in my opinion. The other ones that I can mention are options, but I don't say are necessarily for everybody. So I'm a big fan of intermittent fasting, which is another question. So normally I eat around this time, but because of the busyness of the day, I haven't had my first meal yet today, and I've been doing that for almost. And studies have shown that, especially if you're overweight, this is a great way of restoring your health. You have an eating window. You could choose. Could be a 6-hour eating window, 8-hour eating window, or 12-hour eating window. It all depends on what works for you. So I usually eat between 12 p.m. and 8 p.m. And the nice thing about that is minimizes your calorie intake during that window. You have more insulin free time, which insulin obviously is more associated with fat deposition and so forth. So that ability to have that eating window and reduce that calorie intake relative compared to having those 3 meals can work well for people. That being said, sometimes it doesn't work well for everybody. You can see them spike their cortisol from being a little bit too stressed from not having an ability from not eating. So I've seen it almost have reverse effect on people, but you just find out if it works for you. Another option for not everybody, but for some people, is a low carb approach where you just minimize your carbohydrates, or not eliminate them, but minimize them. This is very effective, I gotta say. Like a lot of the refined carbohydrates that we ingest are high in calories. So, minimizing your breads, your pastas, and so forth. For rice, for some people, really can move the needle. So that's another option. Harder to sustain, but effective. Next level would be ketogenic diet, which definitely is very effective, but hard to sustain. Looking at less than, I believe, 50 grams of carbohydrate or 30 grams of carbohydrates in 24 hours. Yeah, man, I've seen that work really well for people and quickly, but the hardest thing is to maintain it. And I personally tried it. I hated it personally. I felt low energy, and if I were to do it all over again, I think I would have just taken more electrolytes. I think that's where I lost. But that to me is another one that can be quite effective. The other ones are a little bit more extreme, carnivore diet, seen that work for people. But once again, from a sustainability aspect, it can be very challenging. Someone was asking me about a book called Your Doctor Will Not Heal You, referring people who are living unhealthy lifestyles. Is there a question? What tips can you please give? A lot of questions around like you don't have time. People feeling like they don't have time to get healthy. And one of the things that I'll say is why we wrote the book and why we work with the folks at MindStride is we want to make it as simple as possible. So not to be repetitive, but the protein thing to me, is the easiest thing. If you normally have 1 chicken breast, make it 1.5 chicken breasts and then build it from there. From an exercise perspective, I'll just say this one of the underappreciated hacks is using high intensity interval training for your exercise. So for me, when I'm on ICU, my workouts are less than 10 minutes. And an example of that is using Tabata technique. So what it is 20 seconds on, 10 seconds off, as hard as you can go for 8 rounds. So that for one Tabata exercise is 4 minutes. And so an example of doing a Tabata would be you wake up in the morning, do a little bit of stretching, whatever, 20 seconds of burpees, 10-second break. Do that as fast and as hard as you can for 8 rounds. And there's apps out there that have the Tabata timer, but this is as simple as it gets. You could do burpees, I'm a big fan of kettlebell swings, you could do mountain climbers, push-ups, chin-ups. Chin-ups are a little hard, actually. You'll get gassed out from chin-up. You could do like a bunch of these bodyweight exercises, but if you're at the gym or if you have a little bit of equipment, you could do power cleans. That's a nice one. That's whole body. What else am I thinking about? You could do goblet squats or any form of squats during that Tabata workout. So when you only have a bit of time, and it's just as good as doing 30 minutes of sustained cardio, studies have shown. So when people tell me they don't have time, I run an ICU. I got 3 kids. Working in an ICU. Like, if I could do it, you could do it. For sure. Okay, lose weight, exercise, healthy habits. Where do I start? Start with, this is a good question about habits. I gotta say, if you do, it all starts with habits. And this is why I think when you're deciding what is a win, like how I'm doing well, I want you to more of you to be focused on process, not on the outcome. The fact that you got to the gym 3 times a week, that's a win. The fact that you focused on protein 5 out of 7 days of the week, that's a win. Even if the results aren't coming in right away, they will come. But if you're waiting for, oh man, I was hoping to be down 10 pounds in a week or 2 weeks, whatever it might be, you'll lose that momentum. You're less likely to create that habit. So just look at, the most important thing is creating that healthy habit and make it easy. Like one of the things that I love as an example, if I want to do a kettlebell workout in the morning, my kettlebell's right beside my bed. I'm not gonna, I'm gonna eliminate barriers. If you feel like going after work to go to the gym is too much for you, then don't do that. Work out at home or go before work. But do whatever you need to do to minimize those barriers. So this is a loaded one, so I'm going to just try and break it down. A lot of perimenopausal women are struggling with their weight and many other things, their sleep and having multiple symptoms. So 2 high-level things to talk about. 1, all the lifestyle modifications that we've talked about, exercise, nutrition, especially minimizing alcohol intake actually is a big one. All this applies to making life easier as you're navigating a perimenopausal time of life. The second one is to talk about whether hormone replacement therapy is for you. And so I think looking at whether it's an option for you, because a lot of the symptoms you may be having would be hormonal. So talking to your doctor about this, we have clinicians in MindStride that also can help out with this. Hopefully we move in the right direction. Yeah, it's a good question. Ways. One is from a stress perspective and a sleep perspective, it can be used to help out. Some folks get some muscle cramping and so forth, and so I think it doesn't hurt to be taking magnesium. But I wouldn't say it's something that every perimenopausal woman needs to be taking at all. Like it's just another tool in your arsenal that you could use to reduce stress, improve sleep, because sleep can be very challenging in the perimenopausal state. For sure. Awesome. How to get rid of stubborn baby fat on your stomach. Definitely making sure you have enough protein intake, not being focused on that. And then lifting weights. People think it's lifting weights will make you just bulkier, not necessarily get rid of that abdominal fat, but when you put on more lean muscle, you naturally will burn more calories. We call it the basal metabolic rate. Your muscle will need more energy to maintain itself. And then the third way is muscle loves sugar and loves insulin. So you will, instead of having more circulating sugar and insulin, you're going to reduce that. And a lot of insulin, people that are having high blood sugars are relative, often is stored as body fat or visceral fat or abdominal fat, sorry. So that's another way to really get rid of that stubborn baby fat. And the other one is like avoiding beer. Like not saying can never have beer, but a lot of people, the bloating, the high levels of carbohydrates, the typical answer is no, you won't need to. As long as you have normal kidneys, if it's excessive, most of us will just pee it out. You don't need to be checking your levels before taking magnesium. The other thing with blood levels is it's like very sporadic. Like it's not a consistent number, depending on what you ate, depending on how much is stored in your cells versus in the blood. Yeah, very good question. So just for transparency, we have our own supplement line that primary focus is on protein powder. That's why I got into it, guided nutrition. And I'll tell you straight up, this is not something I think everyone needs to take on a daily basis. Just as Pat alluded to, it's, are you meeting your protein goals? And for some people to get to their goals, it's hard to do it without supplementation. And there's actually really good evidence about if you took protein powder before your meal, if you're struggling with your weight, like you're going to lose weight and you're going to have better blood sugar regulation. Like there's some good studies around that. So to use it as a tool to help you gain, not only lose weight, but also get to your protein goals is a very great tool. And then the other kids will probably about 3 or 4 days a week, especially if they're not feeling like a big breakfast. It's a nice way of getting the nutrients shake. So yeah, that's our approach we do in our house. Not everyone needs to be taking it on a regular basis. That I think is a good one. Should I take creatine daily? I am not a bodybuilder, but I move daily. If yes, what time of days is the best time to take it? So easiest question is, I think almost everyone should be taking creatine. I think even if you're not a bodybuilder, we talked about recovery. You're just going to maintain your lean muscle, which is just as important as gaining muscle, is not to lose muscle. That you're going to be sharper mentally. You're going to have less anxiety and depression. So to me, for those reasons, almost everybody and their mother should be on it. That's one of the ones that I take daily. Vitamin D, especially having dark skin. Creatine I take daily. and I take magnesium at night. So the Dr. K personal cocktail, that's the ones that I take on a regular basis. And then the question of time of day for creatine, to me, it doesn't matter. And I think the studies have shown it doesn't matter. Especially, it doesn't need to be around training if you're doing that, as long as it's ingested at some point during the day. You can take it with meals if you find it upsets your stomach, but I think most of us, after you take it for a period of time, the stomach upset will diminish. And just to be clear, all these tips, like it's not only to get you back into better shape, but it's directly tied to longevity and health span too, eh, guys? Like this is the goal is to not only live as long as possible, but to live that functional life, to live that life where you're fit, you're able to play with your grandkids, you could lift up, you could get yourself off the ground if you fall, like all these things that will allow you to live that long, illustrious life. So that's the logic behind what we're doing here. And I hope you all found that helpful. I don't know if there's any other questions, Pat.
That came in. So I think we're in pretty good shape. Great. So we'll keep doing this. Like this is the first virtual Ask Me Anything, something every month. I know it's the middle of summer, so I'll have to go on vacation. So that's why we recorded this, and we'll send it out. But thank you everyone for to help everyone out, get you access to the care you need, and get bigger the business that we're in. So assessment, body scans, all around, emphasizing the importance of these categories and really understand